Hello, my name is Dr. Dewan S. Raja. Today I will discuss about actinic keratosis, also called solar keratosis. What is the definition of actinic keratosis? Actinic keratosis, also called solar keratosis, is a pre-malignant lesion of the skin caused by chronic exposure to ultraviolet radiation, that is the UV radiation, considered a precursor to squamous cell carcinoma. So these surfaces like this, the dorsum of the hand is exposed to sun and exposed to ultraviolet radiation, and there are skin changes. These are the features of actinic keratosis. What is the epidemiology? Common in fair skinned individuals with prolonged sun exposure, like this. More frequent in elderly patients, more than 50 years. High prevalence in tropical sunny climates, like in Australia. Or also it is common in the Celtic population, Europeans, Scandinavians. Risk factors: chronic sun exposure, UVV greater than UVA, fair skin, Fitzpatrick type 1 and 2, like this individual, outdoor occupation, farmers, sailors, construction workers, immunosuppression, that is organ transplant recipients, male sex, slightly higher prevalence of getting actinic or solar keratosis. So these are the features of solar keratosis. Clinical feature: multiple rough, scaly, erythematous, brownish papules or plaques, common sites face, scalp, particularly bold areas, ear, dorsal hand, and forearm. Often asymptomatic, sometimes pruritic or tender. Sandpaper-like texture is a classic description. Lesion may progress to squamous cell carcinoma or invasive squamous cell carcinoma. It may progress to squamous cell carcinoma in situ or invasive squamous cell carcinoma. Histopathology: atypia of basal keratinocytes, hyperkeratosis, parakeratosis, solar elastosis in dermis. Diagnosis: clinical diagnosis is common, biopsy indicated if lesion is indurated, rapidly growing, ulcerated, or tender, and biopsy is also indicated to exclude early squamous cell carcinoma. Histopathology of solar keratosis: epidermal nuclear atypia, variation in size, shape, and staining, must involve basal layer, nuclear enlargement, key feature, hyperchromasia in the nucleuses of these cells, in these cells. Okay. Abnormal epidermal architecture, palisading, parakeratosis. Okay, we have keratosis here. May alternate with orthokeratosis, especially early lesions. Irregular acanthosis, so there may be some changes in the skin color, and that is irregular. Treatment options: destructive therapies, cryotherapy, liquid nitrogen, curetage and electrocautery, laser ablation. Topical therapies for multiple lesions or field cancerization, 5-fluorouracil imiquimod, immune response modifier, diclofenac gel, around 3%, ingenol mebutate. Okay, so treatment continued here. Photodynamic therapy, aminolevulinic acid, and red-blue light exposure, surgical excision for suspicious resistant lesions. Prognosis: about 10 to 20% may progress to squamous cell carcinoma over years. Risk is cumulative, especially in immunosuppressed individuals. Regular follow-up and sun protection are essential. Prevention: sun avoidance, especially midday. Broad spectrum sunscreen SPF greater than or equal to 30. Protective clothing and hats. Regular dermatological screening for high risk patients. And that's all about actinic keratosis or solar keratosis. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.